Humans have 20,000 to 25,000 genes. No, not that kind. These genes are pieces of DNA inside our cells. They tell the cell how to make the proteins the body needs to function. DNA is basically the genetic blueprint in each cell. Sometimes, genes can become damaged. These gene changes, also called mutations, play an important role in the development of cancer.
So the discovery of the genetic impact on tumors has completely changed the way we think of cancer, the way we diagnose it, as well as the way we treat it. And we have made a lot of advances when it comes to cancer therapy based on our understanding of the genetic changes at the cellular level in cancers and tumors.
As researchers learn more about the changes that help cancer cells grow, new medicines are being developed to fight these changes. Targeted therapy is a type of medicine that targets and attacks these changes directly. Immunotherapy is another type of medicine that puts your immune system into overdrive so that it recognizes the cancer and fights it.
And our understanding of these pathways can help us and scientists discover new ways to try and not only treat the cancers, but also improve side effects, which can, of course, positively impact someone's cancer journey by improving quality of life.
In order for doctors to know what changes or mutations a gene has, they might suggest that a patient undergoes genetic testing.
Genetic testing involves looking at an individual's specific DNA to see if there's an abnormality that either caused their current cancer or puts them at risk for future cancer.
Genetic testing is typically done on the tumor itself. So usually when cancer is diagnosed, there's a biopsy or a surgical specimen that's looked at under the microscope. And this tissue can be analyzed to detect certain genetic changes. But sometimes it's possible to have certain genetic tests done through the saliva or through blood samples. So there's many different options for genetic testing, and it really depends on what it is that you're looking for in terms of the tumor type, or whether it is to help treatment options for a cancer or to determine an individual's risk for future cancers.
Although there have been incredible advances in targeted therapy for the treatment of cancer, there are still only a handful of cancers in which this work has been done. It's very exciting to see in the future how many more breakthroughs we can come up with so we can use this very specific type of treatment to cure more cancers.
To assess your own cancer risk or to learn if your type of cancer can benefit from targeted therapy or immunotherapy, talk to your doctor. Together, you can decide if genetic testing is right for you.